normalize the taboos that are around and different topics like mental health, menstruation, and sex education. So the talk is something that we actually started to make sure that the sex education part of the taboos around sex and everything is covered basically, and it's normalized, right? So this is one such topic that we are never taught and are assumed that people know. We want to make sure that isn't the point here, and that's the reason uh, we have this panel today, who is going to take up, who are a part of the section team, who will be taking up the session. So, without further ado, I'm going to announce the panels for you all. So we have Taruni, we have Jeevan, we have Hamza, Siddharthan, Saransh, Shivani, and Vaishnavi. So a bit of background about these people are basically these people are medical students, medical college students who also have the same mindset of stigmatizing the taboo, sex education. So thanks to the panelists first of all for joining, and thanks to the participants for joining. Uh, let's go on with let's proceed with the meeting, and a few more announcements before we actually start the meeting. As you can see in the screen, just make sure you're actually having your full name so that there'll be a certificate which will be issued, which will be helpful for you. At the end of the session, we'll be taking a screenshot and we'll be issuing the certificates, right? So that's one thing. And the second thing is basically that all the doubts, please send it to the host on chat, and we'll make sure that all the doubts are answered. And if at all, if there aren't anything which is answered, we'll be taking it up with the WhatsApp group that we have already shared with the link that we've sent. So as everything is done without further ado, let's start with the campaign. Over to Tarun. Tarun, I guess you've muted.
I'm so sorry. Okay, am I audible now?
Yes, perfect. Good to go.
Okay. Hi guys, good evening. I hope all of you are safe and fine. I'm just going to remind everybody to again rename yourselves with your proper full names as these will be used in the certificates because I still see some people with usernames. Okay, so we're going to start with the talk. And this is a very important campaign.
Taruni, sorry, just a second. Can you make me host? Because there are few
Sure.
people who are having difficulty to join. So maybe it's because my line is better. I'll check it quickly what the problem is. And you can go
Sure,
ahead.
just
Yeah.
1 second. Can you reclaim the host role from me?
I'm not sure. You can just right click on my name in the participants list.
Doesn't work. I can only make you a presenter.
Ah, so that's fine. Let's go ahead with the session. It's fine.
Okay.
Yeah.
Just give me a second, please. Okay, that's all that I can.
Yep.
Yeah, I guess that's sorted, Shiv, yeah?
Yeah. Yeah.
Okay, I'm so sorry, guys, for the... Okay, so we're going to start with the talk. As you guys all know, this is a sex education campaign. And so first, we'll be looking to understand the female and the male body. So first, we have the female reproductive system. So I'm just going to run over the parts in general so you guys have a total overall outlook of this. So in the female reproductive system, the ovary produces the egg, and that is the sex cell for the female. So the egg travels up the fallopian tube and moves into the uterus. So in the uterus, the endometrium is one of the most relevant or the most important parts of discussion here, because the endometrium is involved in two very important processes. One is menstruation and the second is pregnancy. So, if the egg does not fuse with the sperm and become a zygote, the endometrium just thickens completely and is shed at the end of every cycle. But if the egg fuses with the sperm, then the fused egg along with the sperm gets implanted into the endometrium, which causes a pregnancy. The vagina is the part of the female reproductive system that allows entry of the male reproductive system, that is the penis, during intercourse. So next we're going to look at some proper hygiene practices for females. So first, you're supposed to clip and trim pubic and axillary hair. Rather than a general notion, it's usually considered that it's more hygienic to have a clean pubic area without any hair. But contrary to that, it is actually pretty protective to have hair around your hygiene, around your pubic area. So we prefer not to shave, as this can open some pores and cause bacterial infections. Next, you're supposed to wash the external genital area with soap and water and always keep it dry. You do not need for any special wash or any soap or any douche. You're supposed to use clean and dry undergarments and change it every day and replace it every 3 to 5 months. And during your menstrual cycle, it's important that you wear cotton pads and change your pads every 4 to 6 hours. Over to Jeevan.
Yeah, good evening. Am I audible?
You're audible, Jeevan. Go ahead.
Yeah, okay. So this is the male reproductive system. Uh, we have the testis, which is the most important part of the male reproductive system. It produces the sperms. It is the male sex cell. Those sperms are produced in the testis and stored behind it in a part called epididymis. And at the height of arousal, sperm travels through the ductus deferens or vas deferens all the way up to the seminal vesicle. The seminal vesicle secretes fluid called the semen, which is rich in proteins and nourishment like fructose, which provides nourishment for the sperms to travel in the medium. Um, and then it reaches the prostatic urethra, and then it continues as ejaculatory duct towards the penis. The red color part in the penis or muscles surrounding the penis, there are three important muscles. So during arousal, blood supply to these muscles increases and the penis enlarges in size, width, etc. Mm, so, in various religious practices, they follow circumcision, a process of removing part of foreskin. Foreskin is the skin surrounding the penis. So they remove the part of foreskin over the glans penis or the head of penis. So actually, it is a very healthy thing. So if there's no foreskin, there is no collection of semen or ejaculatory remains under the foreskin. So it doesn't cause any local irritation, etc. Hygiene practices for males: you have to regularly clip and trim the pubic and axillary hair. You have to, while trimming the hair over scrotum, you have to be extra careful because there are rugosities present over the scrotal skin and it makes it more prone for injuries. You have to wash the penis, foreskin, and scrotum at least 2 times a day and every time after using the restroom. Make sure you clean the underside of the foreskin too, because there can be ejaculatory remains inside it and it can cause local irritation and bad odor. And you have to wear loose fitting clothes because if they are tight around the crotch and moisture is trapped inside, again it can cause local infection, etc. Over to Hamza.
Hi everyone. Am I audible?
You're
Yes.
audible, Hamza. Yeah.
All right. Okay. So this topic is about sex or gender and sexual orientation. So your sex or your gender is a biological thing. It's determined by genetics. So there is male or whereas sexual orientation is determined by your romantic attraction or your sexual attraction. So romantic attraction and sexual attraction can coexist together. It is also possible to have them completely separate. It is possible to have only sexual attraction or only romantic attraction. And based on what the definition of the romantic attraction or sexual attraction for any individual is what determines their sexual orientation, as you can see that's listed down here. So these are the more common sexual orientations: straight, lesbian, gay, transgender, so on. All right, and the next topic that I'll be covering is puberty. Puberty is a transitional process that every person goes through. It is the process that, sorry. So, sorry.
Participants, participants, could you please mute your sites? Rohini, yeah, thank you. Okay, go on, Hamza.
Sure. Where was I? Right. So it's a very individualistic process that everyone goes through, and it's the transition period that a child's body turns into an adult body, both for male and female. It usually starts around the age of 9 to 11 in girls, and around the age of 11 for boys. And there are a lot of different factors that affect the age at which puberty starts, such as your diet, your level of exercise, your weight, exposure to pornography and other sexual content, hormonal imbalances that are regulatory towards puberty, and if you were on any sort of regular medication such as hormonal pills. The important thing to note here is that even though it is very important to have a positive body image, it's also important to remember that at least during puberty, you need to keep your weight and BMI within healthy levels so as to avoid any sort of complications. And puberty is something that everyone goes through, and it's very individualistic. So even amongst siblings, they can go through puberty at different ages, at different times. As long as you are maintaining a healthy weight, a lifestyle, a regular amount of exercise, this whole process is completely normal. So next up, we will have a few points on the changes that female bodies go through. So during puberty, the common changes that girls can experience is the enlargement of their breasts, the enlargement of their hips, the widening of their hips, axillary hair growth, so hair growth in the underarms, enlargement of the uterus, pubic hair growth, as well as menstruation. And for boys or males, some of the changes that they can undergo are, I think, next slide. Yeah, so some of the changes that they will undergo as boys or males is the enlargement of the testes and scrotum, the growth in the length and width of the penis, occurrence of facial hair, occurrence of axillary hair in the underarms, the occurrence of pubic hair, the deepening of their voice, and so on. And now it is over to Siddharthan.
Give me a second, Hamza. I think we're going to start the meeting from the top again because some people had difficulty in joining us and they've just joined us. Yeah?
All right, sounds good.
Okay. So we're going to go back a few slides. And I think we'll wait for a minute. And 1 second.
So hey all, sorry there was an issue with the lines. I guess we are good to go right now.
Yeah. Okay. So for those of you,
brush up. Yeah.
Exactly.
So we'll brush up the slides that we've already gone, and we'll start with whatever we have done before, right? So I guess we are good to go. There are people around who joined who have texted me that they were having some issues. So yeah.
Okay. So for those of you who joined, please look through these rules and please log in with your full names because I can still see some of you have usernames and email IDs as your names. These will be used for certificates and please keep your mics on mute throughout the session. And please send all your questions and doubts to me or to the host, and we'll answer at the end of the session. And please raise your hand if you want to speak up during the session. We still have people joining in, so I think we'll wait a minute and then we'll start.
So yes, I guess we can start this.
Yeah,
We're
okay.
good to start. Yeah.
Okay. So the talk is sex education campaign. Sorry for those of you who are going through this again for the second time, but yeah. So first, let's familiarize ourselves with the male and the female body, and we have the female reproductive system. So I'm just going to give you a general outline and overlook of the female reproductive system. The ovary produces the egg, and the egg travels through the fallopian tube into the uterus. Now, the uterus has three layers: the perimetrium, the myometrium, and the endometrium. The endometrium is the most important layer or the most important part of the uterus because it takes place in two of the most important cycles of the female life. One is the menstrual cycle, and second is the pregnancy. So, if the female becomes pregnant, the endometrial layer is what will receive the fertilized egg, also the egg which is fused by the sperm. And if the woman is not pregnant, then the woman sheds this endometrial layer as a menstrual blood at the end of each cycle. Arousal causes blood to flow to the clitoris and the vulva, and this causes seeping of moisture through the vagina, and this causes lubrication. So, vagina is the part of the female reproductive system which allows entry for the male reproductive system, that is the penis. So, some proper hygiene practices for females. Generally, it is people feel that it is best or more hygienic when you have no pubic hair at all or when you shave your pubic hair. But pubic hair is actually protective in nature, so it's preferred to clip and trim pubic and axillary hair, or otherwise not shave pubic hair, as this can open some pores and lead to bacterial infections. You should wash your external genitalia with soap and water and always keep it dry. You don't need a special wash, soap, or douche to clean your vagina. You're supposed to use clean and dry undergarments, preferably cotton ones, and change them every day and replace them every 3 to 5 months. During your menstrual cycles, please wear cotton pads and change your pad every 4 to 6 hours. Over to Jeevan to talk about the male reproductive system.
Yeah, good evening. This is the male reproductive system. The testis forms the most important part of the male reproductive system. It produces the sex cells, male sex cells called sperms. They are produced in the testis and stored behind the testis in a part called epididymis. The epididymis continues as ductus deferens, or also called as vas deferens, all the way up to the seminal vesicle near the urinary bladder, right over here. Um, the seminal vesicle secretes the seminal fluid, which is rich in fructose. Um, so some of the proteins that are responsible for the nourishment of the male sex cells present in the fluid, and it continues as ejaculatory duct from there into the prostatic urethra and all the way up to the penis. The red thing in the penis is the muscle surrounding the urethra and the penis. There are three important muscles. So during arousal, the blood supply to the muscles here increases, and the penis increases in width and size. The end part of the penis is called the glans penis, or commonly called as head of the penis. So, and over the penis, you have the foreskin. Normally, after adolescence, also, you should be able to retract the foreskin behind the glans penis. If you're not able to do so, it's a condition known as phimosis, and I recommend you to check with the doctor. Mm, okay, next slide. Uh, Proper hygiene practices. You have to regularly clip and trim the pubic and maxillary hair because uh, uh, any hair follicle present anywhere is more risk for infection. So, and also while trimming the hair over the scrotal region, be extra careful because of the rugosities present over the scrotal skin, which makes it more prone for injuries. And wash the penis, foreskin, and scrotum at least 2 times a day, and every time after using the restroom. Also, make sure to clean the undersurface of the foreskin because after ejaculation, some remains can be present underneath the foreskin, and it can cause bad odor, local irritation, and inflammation. And wear loose fitting clothes because if those are tight around the crotch and moisture is trapped inside, it's more prone for infection. Over to Hamza.
All right. Hi, everybody. I hope everyone's doing well. So the first topic I'm taking is sexual orientation. And this is different from your sex or your gender, which is a biological factor, male or female, whereas sexual orientation is dependent on romantic attraction and sexual attraction. It is possible to have the both attractions coexist, and it's also possible to be purely romantically attracted to or sexually attracted to an individual. And based on this, based on where that attraction lies, is what determines your sexual orientation. As you can see, we've listed here as the more commonly known orientations: straight, lesbian, gay, transgender, so on. Next slide. So the next topic is puberty. Puberty is a transitional period that every person goes through, and it's a process that starts around age 9 to 11 in girls and around age 11 in boys. And it's the process that transitions from a child's body to an adult body. And it's a very individualistic, unique process. Everyone goes through it differently at different time rates. Some of the factors that affect the age at which puberty starts are things like your diet, the amount of fatty food and fast food that you eat, the level of exercise you're having on a regular basis, your weight, exposure to pornography and other sexual content, hormonal imbalances, and any sort of regular medication that you might be on, such as hormonal pills. And it's very important to note that although having a positive body image is important, it's important to remember that during puberty, it's very important to maintain a healthy weight and a healthy level of exercise and a healthy diet so as to avoid any complications throughout puberty. Next slide. So some of the common changes that girls or females will experience throughout the entire phase of puberty is the enlargement of breasts, widening of hips, occurrence of axillary hair, so hair in the underarms, enlargement of the uterus, the occurrence of pubic hair, as well as menstruation. And next slide. For boys, or males, the changes that they will undergo during puberty is the enlargement of the testes and scrotum, growth in the length and width of the penis, the occurrence of facial hair, the occurrence of axillary hair, hair in the underarms, the occurrence of pubic hair, deepening of voices, and so on. And it's important to note that although puberty is a process that everyone goes through, it is something that is very unique to one individual. So even two siblings from the same family can undergo puberty at different times, have different phases, different growth spurts. And as long as you have a overall healthy lifestyle, a healthy weight, it is completely normal. And now it'll be over to Siddharthan for the next topic.
Hi guys, can you guys hear me?
You're audible,
Bye.
Siddharth.
Okay. So my topic is going to be for about virginity. Um, Traditionally, we know virgin as someone who has never had sex because that's what we all know it as. But then nowadays, as Hamza has mentioned, there are different meanings for sexual, I mean, different kinds of sexual orientation. It is not just men and women anymore. There are women and men and men. So how can you say what is virginity between, I mean, what does virginity mean for them? It can be different. If it's two gay men, it could be anal sex or it can be anything else. If it's going to be among women, it can be just oral sex. So since nowadays virginity can mean a lot of different things, so sex means a lot of different things. So hence virginity can mean different things as well. Now we're gonna have a poll. Um, yeah, can you guys quickly see this poll and answer? Which of the following causes stretch or tear of hymen? If you don't know what is hymen, don't worry, we will be explaining it later on. But if you don't know what hymen is, then do answer this question.
The question is not visible.
It's not visible. Check your.
Yes.
Um,
Okay, is it not visible only for him or is it not visible for anyone else?
does anybody else have this problem? Please reply on chat. You will, those of you who are using your cell phones to attend this meeting, you will get a
I'm
little
using laptop.
tab that says this, that open poll. So you're supposed to click OK on that.
Using laptop.
I think you should get a tab
If you have a
that
laptop, it will just open in the right side. Like where the chat is, yeah. So it should just open over there called polling. Did you get it?
No, it has an
Okay, fine. I
menu
will
with
read out
three
the
dots
options. Okay, fine. I will read out the options as well. So for those who don't see it, they can reply and tell the answer to the host. Okay, the question I'll repeat it. Which of the following causes stretch or tear of hymen? Option A is intercourse. Option B is sports. Option C is menstrual cups. Option D are tampons. And option E is masturbation. I will repeat the options again. Option A, intercourse. Option B, sports. Option C, menstrual cups. Option D, tampons. And option E, masturbation. For those who don't can't see the poll, you can tell the answer to the host and she will note it down. Is that fine, Krishna? Do you want me to repeat anything?
No.
Okay.
Intercourse and sports.
No, don't tell it here. Just type it
Yeah.
out to them.
We don't want any of you guys to answer over here, so you don't even have to send the answer to me. This is just to get a understanding of how well or how much you know this, so we can explain this to you better. Okay, so I'm going to be closing the poll in a few seconds now. So for those of you who haven't answered, please try to answer it. I hope you all can see the poll results on your phones or on your computers now. Okay, over to you, Siddharthan.
Okay, so as expected, many have answered the most common ones, but actually the answer is all of the above. I will explain a little bit more on that. Okay, what is hymen? For those of you who don't know what hymen is, it is a part of the female's external genitalia. It is basically a very thin piece of mucosal tissue. It's like a thin film that surrounds the external opening of the vagina. So basically, it just covers the opening. So, in the olden days, and even now, sometimes in certain families and places, they do consider that if this hymen is broken, that means that woman is not a virgin anymore. This used to be an old belief. They are not wrong, but they are not right either. I will tell you how. Now, just because the hymen is broken doesn't mean that that they had to have an intercourse to break it. As I said, the answer is all of the above. I shall explain how. Now, this membrane, as I said, is very thin, so any kind of a stretch can tear it. It is elastic, but not very elastic that it can, you know, be very strong to avoid being torn. One of the most common answer is intercourse, and sports is another very common situation in which this hymen can be torn. Now, many women, when they start their adolescence in puberty and they start having the periods, the most commonly used one is are pads. But then there are tampons and menstrual cups which have to be inserted through the vagina, which can break the hymen. And of course, and for obvious reasons, there is masturbation. So it's just disbelief that a broken hymen means virginity. It does not necessarily mean that the person is not a virgin, but it is a possibility. And I think now it's over to Saransh, sorry.
We have another poll now, so please attempt this poll. Also, while you guys answer this poll, I am receiving questions now and I'm noting it down. We will answer all the questions at the end of the session. So please stay with us till the end of the session. Okay, so I'm going to close the poll in a few seconds. Okay, so we have a question here. Siddharthan? You're not audible, Siddharthan. Your side is on mute.
Okay, I'll read out the question now. Is there any proof point of virginity in men as women have, namely so-called broken hymen? Well, I don't believe in this virginity concept. For men, unfortunately, I personally don't think I can think of one. But no, there is no proof point of virginity unless that man is very honest. But I don't think there is anything else. Broken hymen, that is, as I said, it's an olden concept. I mean, it's still not very practiced now because now, okay, people do realize that there are other ways in which it can be broken as well. But this is more used to be more common in the olden house, or in those old-fashioned house families, as you can say, or Orthodox families. So it's like in those kind of people only. But no, I don't think there's anything to show that men are still virgins or not.
Okay. Okay, so to clarify this further, since a lot of women now use tampons, tampon is a menstrual product which you insert inside your vagina. Uh, and also menstrual cups, and a lot of us play sports now, and masturbation is very normal. So these practices usually cause a tear in the hymen. So hymen as such is not a concept of virginity for women also. That's what we're trying to say in this slide. So I'm just going to, I've already stopped the poll and I'm sharing the poll results. Over to Saranj.
Good evening, guys. So, as I can see the poll here, I I see that almost 51.5% people believe that there are no side effects of masturbation, and that is the right answer indeed. There is Masturbation doesn't cause any kind of blindness or erectile dysfunction or balding. These are just myths, plain myths that have been told to us from a very long time, but it doesn't cause any of these. So over to my topic. So I'll be talking about masturbation. So what's masturbation? It's an act of stimulation of one's genitals to achieve sexual pleasure and arousal. So it is done by stroking or massaging the penis in case of the males and the clitoris in the case of females. Masturbation is a very normal and a healthy sexual activity, and it plays an essential role in the development of an individual's healthy sexual activity and healthy sexual being. So, and it's also a normal part of a growing child's exploration of his or own body. And so now let's go on to the benefits of masturbation. Basically, masturbation, it helps in relieving sexual tension and stress. It's a stress buster to me, and it also enhances the quality of sleep. It also helps in elevation of one's mood and can even boost your concentration. And in the case of females, it can also relieve menstrual cramps. And masturbation also helps in reducing the risk of pregnancies and sexually transmitted diseases. and and masturbation is a way one of the ways to know what pleases you erotically. And actually, then now talking about side effects, then nothing much side effects exactly, but it's just a few notions that can irk your conscience. It could be like guilt. So some people feel that masturbation hurts religious or social or spiritual cultural sentiments. And then there is also one more side effect. What people believe is that what can happen in your life is there might be disruption of your daily life activities, like missing work or school, and it can also affect your relationships. So people sometimes take masturbation as an escape from the reality, and they run away from their responsibilities and relationships, which can be bad. And there is also added benefits of masturbation. So some studies have proven that masturbation can decrease the risk of prostate cancer in males later in their life. And if you have a plan to conceive a child, it is advised to have a period of abstinence, that is no masturbation, for at least 3 days, so that you can increase the chance of conception. So in the end, I would like to conclude by saying that it's not a sin or a crime. It's completely normal, and your pleasure, that is self pleasure, is not a wrong thing. And you can use your body as a guide to do to explore things. And so on a lighter note, I would like just like to end by saying the good thing about masturbation is that you don't have to dress up for it. Thank you. Over to Karunyaka.
Hey, Dharmesh, sorry, you're on mute.
Okay, so we have a question here that asks how masturbation can relieve menstrual cramps. Okay, so for females as such, masturbation is usually, I mean, when you masturbate and when you reach orgasm, your uterine muscles contract in such a way that it's generally designed to move your uterine muscles such that it facilitates the movement of sperm towards your uterus. So, in such cases, during menstruation, you usually have menstrual cramps because your uterine muscles are constantly contracting and relaxing to push out the endometrial tissues and blood outside the body. So, when you masturbate and attain an orgasm, you have menstrual contractions that occur, and this helps your uterus to expel the endometrial layer. Um, okay. Okay, so I'm going to talk about intercourse. So we're going to talk about two or three different things of intercourse here. One is before intercourse, during intercourse, and after intercourse. So before intercourse, it's very important for a person to know their partner well and to be aware of their past sexual and medical history. You might have just one sexual partner, but your sexual partner can have more than one sexual partner. Or he might have had just one sexual partner with a medical or sexual history of sexually transmitted diseases or a urinary tract infection or a fungal infection or a yeast infection. So it's very important to know your partner's sexual history and their relevant medical history before you move in to have intercourse with them. Consent and will. Consent and will is very important before you have intercourse. You must want to have intercourse and you must also consent to having intercourse. You must also set boundaries and comfort zones with your partner so that you don't have any awkward or unpleasant memories or moments after your intercourse. And you should be of sound mind. And of sound mind means that you should not be under the influence of drugs or of alcohol or under the influence of anybody else's saying for the intercourse, again, to avoid any regrets in the future. And this is about pornography. Usually, porn paints a very unrealistic picture of sex and of romantic experiences for us. But these experiences are rarely met in real life. Okay. So the next slide is about during intercourse. Intercourse should not hurt even for the first time. This is a common myth that the girls are told that sex should hurt for the first time. Um, Sex should not hurt for the first time because, like I said in the first slide of female reproductive system, your body naturally produces lubricants when you're aroused. So, feeling a little pressure is normal, but it shouldn't hurt. It's always important to practice safe sex. You must always use condoms to prevent yourselves from contracting any sexually transmitted diseases. And another myth is that pre ejaculate, that is, pre cum, does not have any sperms. So, having sex without condoms and ejaculating or coming outside the vagina will not lead to pregnancies. But pre ejaculate can have sperms, and these can lead to pregnancies. Like you all know, you just need one sperm to go and fertilize the egg from those millions of sperms to cause a pregnancy. So if you have one good swimmer in the pre-cum, that's going to lead to a pregnancy for the girl. So the next point is about lubricants. Lubricants can be used to increase the efficiency of condoms as they decrease the friction, and they also help ease the experience when you use condoms. Hymen and virginity has already been discussed in the previous slides. I'm going to open a poll question now. Please attempt the question, and I hope this goes by quickly. Okay, so I'm closing the poll. Okay, so 65% of you have answered that yes, females ejaculate, and 9% of you have answered no, and 12% of you have answered maybe, that females maybe ejaculate. So the answer is yes, females do ejaculate. So let's talk about male ejaculate first, what we commonly know as semen or cum in colloquial terms. So, what is cum or semen? Semen contains two things, seminal fluid and mature sperm. So, what is seminal fluid? Seminal fluid is a fluid that is present to provide nutrition for the sperms and also to provide a medium for them to swim in the uterine environment. Semen is usually milky white and it can range from watery to thick and sticky in consistency. So, what is female ejaculate? Female ejaculate is generally clear to milky white, depending girl to girl, and it can again be watery to sticky in consistency. So, female ejaculate can come out from two different parts of the female body. One, it's secreted from the urethra. This is commonly known as squirting. And the second, it's secreted from the inner walls of vagina. This can happen both ways. You can either have a urethral secretion, or you can have a vaginal secretion, or you can have both. The urethral secretion, that is squirting, is not urine. So that's a common misconception again, but yeah, urethral secretion is not urine. Okay. So after intercourse. After intercourse, it's important for women to pee after sex, and for women especially because we have entry of the penis into the vagina, and this prevents any urinary tract infection and can even lessen the chance of getting a sexually transmitted disease. Spotting is normal for people who have intercourse for the first time and who have intact hymens and have break of hymen. Because hymen is a tissue which has blood supply to it, when it breaks for the first time, it can release some blood and you can have spotting. Pain, burning, or irritation while urination and discharge could be symptoms that point to sexually transmitted diseases, and these will be spoken about later in the presentation. So over to Shivani.
Hi guys. I'll be talking about conception and UPT for this evening. So what is conception basically? So after the intercourse, what happens is the female gamete, that the female sex cell, that is the egg, and the male sex cell, that is the sperm, both fuse in the tubes and form a fertilized cell. So this is now called the zygote. Now what this happens is, hello, am I audible? Hello.
Yes, you're audible, Shivani.
Yeah, you can continue.
Okay. So, as I was telling, the female sex cell, the egg, and the male sex cell, the sperm, both fuses together and forms the fertilized cell, which is also known as the zygote. So now this zygote gets embedded into the endometrial layer. So that is why as Taruni told, endometrium is an important layer in pregnancy. So now what happens is, as Tarani told, endometrium is the basic layer for both pregnancy and for menstruation. Now the endometrium starts providing mechanical support and nutritional support for the developing baby inside the female's uterus. So now now the endometrium can't shed off as menses. So the first complaint when the female gets pregnant will be missing of periods. So this is when she does the UPT test. So this is a test. Okay. The yellow part is the part which is represented by the zygote being embedded into the endometrium or the innermost layer of the uterus, as you guys can see. So this is how it gets implanted into the endometrium. So moving on to the urine pregnancy test. Yeah. Moving on to the urine pregnancy test, how to do it, when to do it. Okay. So when to do it, it must be usually done between 28 to 35 days of after the last menstrual period. This is because after having intercourse. This is because you shouldn't do it as soon as after the intercourse or before the 28 days of within the 28 before the 28 days time. This is because when the fetus gets implanted, when the zygote gets implanted into the endometrial layer, it releases a particular hormone. This hormone takes time to get released into the bloodstream. So this is mainly responsible for answering the UTI. So mainly, as you can see, there is a rectangular box and a circle. The circle is where you place the drops of urine. For the sample, you take the early morning urine sample, and just the 2 to 3 drops is enough to put it in the sample well, which is the circular part, as you can see. Now, if the lady is pregnant, there is a rectangular box which can show 2 line or 1 line. The first line, which is to the left hand side, where it is written as C, it is called the control line, and the second line, which is to the right hand side, is called as the test line. Control line is to show that the test is stated. That is, this test can be taken to be a good test. Like it can be taken. So the control line must be there whether if the lady is pregnant or not, and the test line will answer positive. That is, the line will appear if she is pregnant. The line will not appear if she is not pregnant. So as you can see, the first sample, there are two lines being shown. Control line is also seen and the test line is also seen. So this indicates that the female is pregnant. Now, when you see in the second card test, you can see only the control line is there, but the test line is not there. So which means the female is not pregnant. Now, what if the control line doesn't come and the test line doesn't come? Or there can be a case where the control line doesn't come and the test line comes. So if the UPT comes in such a case, then means the test is invalid. You need to throw that card off and repeat the test again. So this is the interpretation of the urine pregnancy test, and it is not an instantaneous test. So after adding 2 to 3 drops of urine, you're supposed to wait for a minute or two to answer for the test to answer positive. So moving on to another part of thing. Okay, yeah, if you test positive. So if you test positive, we recommend the lady mainly to visit the gynecologist. This is because of two reasons. One is because it may give a false positive test. For example, there may be any other tumor which secretes the same hormone. So that can also give a false positive. So giving a blood test or getting an ultrasound done and checking for fetal parts may give a even more positive sign for pregnancy. And also, we can also diagnose ectopic pregnancies if there is any. So, what is ectopic pregnancy now? As I told, in the normal pregnancy, the fertilized egg cell, that is the zygote, gets embedded in the yellow layer, as you can see, the sandal layer. Okay, that is the endometrium. But what happens in the ectopic pregnancy? The egg which is fused grows somewhere in the tube. So now what is the risk about this ectopic pregnancy is, now the uterus is designed in such a way that it can enlarge in the 9 months as the in the course as the baby grows, but the tube is not designed in such a way. So what happens is, as the baby starts developing and developing, so the tube also enlarges along with it, which leaves with a higher risk of tubal rupture. So which is an emergency case, and the baby has to be delivered in. So if the doctor diagnoses the ectopic pregnancy pre-hand, so she'll be prepared for the proper delivery of the child. So moving on to the proper part of pregnancy, the female can also experience other symptoms like fatigue, vomiting, breast tenderness. Breast tenderness is because while the uterus is ready to for the development of the child and so on so, the breast gets ready for the later part of pregnancy. After the delivery of the child, it is the breast milk that provides nutrition to the child. So the breast starts to enlarge in size, and the growing up of the breast can provide a discomfort or a tenderness of breast for the female. Mood swings and the mental stress of conception. Yeah, this is an important part because there may be unwanted pregnancies, or the couple may not be ready. Maybe the partner couldn't be ready. So all these must be taken into account, and proper measures should be adopted for the abortion techniques if they are not willing to do. So yeah.
Okay, over to Jeevan.
Contraception. What is contraception? Contraception is basically prevention of any unwanted pregnancies. We have various methods of contraception as barrier methods, pills, spacing methods, and surgeries. Um, Slide. A barrier method. So this is the most natural of all the methods of contraception. So with this method, you calculate when you're ovulating, and then you abstain from intercourse during that period. What is ovulation? We already saw um, the egg is released from that ovaries, and they are available for fertilization in the fallopian tube. So normally, let's say this is 5 by 28 cycle with 5 days of bleeding, and the duration of cycle is 28 days. The cycle starts from the day of bleeding as day one, and the bleeding goes on for 5 days. And in this cycle, normally around the 14th day ovulation happens. So 2 to 3 days before and about 3 days after the ovulation, we abstain from intercourse, because at that time the egg is available for fertilization and pregnancy can happen. Also, this is not very effective because we can't tell for sure when exactly the egg is available for fertilization. And also, women who are having irregular cycles cannot practice this method. Uh, Colloquially, when if you want to know when you're ovulating, you record your temperature every day throughout a cycle, and you can see temperature spikes during specific days. So during ovulation, your body temperature is set to go up a few degrees, and with that, you can see when you're ovulating. Next slide.
Okay, so the next slide is condoms, and I'll be taking it. So, condoms are a very important type of contraceptive because these are the most easily accessible and these are the most easily affordable. You can find them in supermarkets, in pharmacies, in grocery stores, or sometimes, even if you can just borrow this from your friend and just go on and use it. So, the first part of the condom, the packet. So, when you buy a condom or when you use a condom, if you've already bought it, you must always check for its expiry date. So, this will usually be written in the back of the box or on the packet itself. And another important thing in the packet is that, please look at the first illustration, is that you must press the packet and check if you can feel a little bubble of air inside, because that means that the packet is sealed and is intact. If you do not feel a little bubble of air inside, or if you can, or if you see an indentation of the condom ring on the packet, then it probably means that your packet has been punctured. Now, if the packet has been punctured, there are chances that the condom also is punctured, and so you must not use that specific condom and you must get another new condom. Opening the packet, you must not open the packet with your teeth or your scissors. You should generally tear it open with your fingers. So, if this is the packet of condom, you move the condom to one side and you easily tear it open from one from the other side. So, next, application of the condom. It's very important to understand how to apply the condom, because if you apply the condom properly, it significantly reduces the failure rate of the condom. So, first, the condom must be applied to the penis that has not touched your vagina yet, or that has not touched the female's external genital system. So, when you open a packet and you take a condom, you must hold it in a way that the tip of the condom is facing down. It is preferable to put a few drops of lube inside the condom and then slip it on top of an erect penis. The condom must always be applied on a fully erect penis. So, when you apply the condom, you must pinch the tip of the condom and then roll it down until the base of the penis. There's a video to explain this in the next slide, which I'll show after a bit. But yeah, so when you look at this illustration, it shows us that you must pinch the tip of the condom and then you must roll it down. It is also advisable to use some lube on top of the condom before entering the vagina for intercourse, as this can again ease the experience and reduce friction, so it prevents tear. How do you remove condoms? When you remove condoms, again, please make sure that your penis is erect while removing. And you're supposed to hold the base of the condom and remove the condom. If, for example, you remove your penis before you remove the condom and the condom is still in the tract of the vagina, you're supposed to tie the condom and then remove it. So this prevents the spill of your ejaculate onto the female external surface, which can enter the genital tract. So there's an interesting question here about flavored condoms. I'm opening a poll to see how the responses are. Also, requesting all of you to please change your names to proper full names, as you want them to be printed on the certificate, because some of you still have usernames and email IDs on the list. Okay, I'm closing the poll. Okay, so as you can see, 53% of you have answered oral sex, 31% of you have answered vaginal sex, and 13% of you anal sex. Okay, so here's an interesting thing. Flavored condoms are only meant to be used for oral sex. Flavored condoms are not supposed to be used for vaginal sex or anal sex. I know that usually condom ads have these very exotic flavors and they said you can use them everywhere you want and whenever you want it. But one thing that they don't put out is that you're not supposed to use it for vaginal and anal sex. So why not vaginal sex or anal sex? It's because when you use flavored condoms to bring about those flavors on the condom, the secretions on it have sugar content. And when these sugared secretions are inserted into the vagina or anal canal, this can cause infections in these body cavities. So, a failure rate. Condoms are on the condom packets and on the WHO website. You can find that the failure rate of condoms is only 2%. But in actuality, the condom has a failure rate of 15 to 20% in India alone. And why does this happen is because we do not know how to apply the condom properly and how to use it properly. So here's another poll. Okay, so I'm going to close the poll as all of you have answered. And I see that a lot of you have answered that two condoms are less safe than one condom, and that is the right answer. When you slip on two condoms, it's a myth that two condoms are safer. When you slip on two condoms, this increases the friction between the two condoms, and you also have friction between the condom and the vagina. So this only increases the friction between the condoms and can also cause rupture or tear of condom. Hold on a second. Let me switch my slide. Okay. So here's a video that shows on how to apply a condom. I'm sorry, just give it a second. Okay. Okay, just hold on. Okay, I'm sorry. There's some technical difficulty in playing this video, so I'm going to share another screen with you. I'm going to play it again. So as you can see here, the tip of the condom is being pinched and the rest of the condom is being easily rolled on. Now, another common mistake is that people usually wear the condom inside out. So how do you know if the condom is inside out or the right way down? Is that it should be able to slip down perfectly. You shouldn't have to put your fingers inside the condom and roll it out. Okay. So there's another poll question here. Okay, someone says that they can't see the poll. Okay, I'm just going to read it out for you. Condoms. Okay, so I'm going to read the poll out to you. The poll is condoms should be changed A after every use, B while switching between oral or vaginal or anal sex, C if worn inside out, D if it comes in contact with the penis before application, E if it tears, and F all of the above. Okay, so I'm closing the poll and I'm going to explain each option to you. Condoms should be so most of you have given the right answer. You've all selected all of the above. So why should condoms be changed after every use? Is because condoms are generally disposable material, so you have to change it after every use, and you cannot reuse it unless you buy reusable condoms. And why should condoms be changed before switching between oral, vaginal, and anal sex? So if you're having oral sex with a person and you decide to switch to vaginal sex, you cannot use the same condom that you have used for oral sex for vaginal sex. And if you have vaginal sex and you decide to switch to oral or anal sex, you cannot use the same condom. And same for anal to vaginal or oral. This is because each part of your body has certain bacteria that are natural to that specific place of body. Like your mouth has some bacteria in general, your vagina has some bacteria in general, and your anal cavity has some bacteria in general. When you switch condoms, or when you use the same condom when you're switching between oral, vaginal, or anal sex, you can transfer this bacteria. You can transfer anal bacteria into the vaginal canal or the vaginal bacteria into the oral canal. And this can cause infections. So, yeah. And if worn inside out, like I said, obviously you have to change the condom because you cannot flip it the other way around and wear it. And if it comes in contact with the penis, it's because the sperms are already on the external surface of the condom, so you can't wear it. And if it tears, I think it's a very obvious question. So we have one last poll for this specific segment. I'm sorry if I'm asking you too many questions. Okay. Okay, I'm closing the poll now. And so I've shared the poll results with all of you. So most of you have answered it right, and I'm just going to clarify why not fit tightly, and none of you have answered fit loosely. So why not fit tightly? Condoms, when they're fit tightly, can have increased friction between the penis and the condom. And also, the little tip that you have left above the condom when you slip it on is to collect ejaculate. If the condom is fit too tightly, you won't have enough place for ejaculate, and the condom can rupture or tear very easily. So we have an interesting question here, and so this is a question. So if someone is not using condoms, do they clean the penis every time they have to change position? Okay. So you generally do not have to clean the penis when you move from oral sex to vaginal sex because, as you know, oral sex itself has mouth to penis contact or mouth to vagina contact. So, but you have to clean your penis when you're switching from vaginal to anal sex and anal sex to vaginal sex. I hope that solves your doubt. And we're moving on to the next part of the presentation. Over to Jeevan again.
Okay, so lubes or lubricants, these are used to increase the efficiency of the intercourse to basically ease the sex. They so many of these have spermicidal activity. So they also kill the sperms. They decrease their motility. So thereby it reduces the chance of getting pregnant. And by reducing the friction, they also decrease the chance of rupture of condoms. And there are many types of lubricants. There are water-based, silicone-based, and oil-based. And uh, water-based and silicone-based are the most recommended to use because oil-based lubricants are uh, supposed to decrease the efficiency of the latex or the potency of the latex. And there are flavored lubes too. Next. Okay. Next method is oral contraceptive pills. So these are pills taken regularly at the same time of the day throughout the cycle. So how they act is the your menstrual cycle is regulated by various hormones in your body, and by prescribing these hormones orally, you can alter your menstrual cycle in such a way that you can prevent pregnancy by hampering various steps of fertilization, implantation, etc. So OCPs, they should not be taken over the counter. They should always be prescribed because it has its own side effects, and the the registered medical practitioner should know your medical history, etc., before prescribing the medicines. They should be personalized. Um, okay, postcoital pills. These are emergency contraceptives, also called morning after pills. Even though these are emergency contraceptives, you cannot take it on your own. You need uh, prescription before you use this. This can be taken up to 3 days after an unprotected intercourse. Um, these are reserved for specific situations because, like unprotected sex or rape, etc. And you cannot use it regularly. Like every time, you cannot have unprotected intercourse and take a postcoital pill because it has its own side effects like weight gain, uh, irregular menstrual cycles, dizziness, vomiting, and fatigability. So long term, it can cause hormonal imbalance and can cause cysts in the ovary. And when you withdraw, it can cause difficulty in conception. I think we have a poll here. Okay,
The participants are submitting responses, so a few seconds, please.
okay, let me discuss.
I'm
Oh,
just
yeah, okay, fine.
sending the poll results. So yeah,
Yes. So many of you said prescribed by a doctor. Yes, it needs to be prescribed by a doctor. Second one, can be bought over the counter for emergency. No, it cannot be bought over the counter for emergency because, as I said, it needs to be personalized based on your medical history or based on the conditions you have. Because if you have conditions like liver diseases, these drugs cannot be metabolized, and you need to switch out to a different medication. And third is they need to be taken the same time every day. Yes, it needs to be taken the same time every day, preferably in the night time, so that the same level of hormone is maintained. And fourth is that just one pill per day. So if you miss one pill a day in a cycle, you can the very next day, as soon as you realize, you can take a tablet, and that day's dose you can take it in the night time. But it's not very effective, but it's better to take it that way. You can do it only once. If you miss another day, you should stop it and start the cycle again from the next cycle, or change your medications according to your preference. Next slide. Permanent methods of contraception. What is a permanent method is that by various modes of surgery, you alter your reproductive system in such a way that you're not able to conceive again, or you're not able to impregnate again. So in females, it is called tubectomy, and in males, it's called vasectomy. And no, these are not reversible. You cannot go back to being fertile again after this. Slide. So, tubectomy is that you cut and ligate or bury a part of the fallopian tube so that the eggs produced from the ovary are not able to travel through the fallopian tube, and so it does not reach the endometrium, does not implant, and no further pregnancy happens. In case of vasectomy, you cut and ligate the vas deferens so that the sperms don't reach from the testes, and just the seminal fluid uh, from the seminal glands will come out. Okay. Uh, Okay, over to the poll. You can answer the poll now. Can men ejaculate after vasectomy? Okay, so many of you answered yes, and some of you answered maybe and no. The answer is yes, men can ejaculate or come after vasectomy, because after vasectomy, you just prevent the sperms from reaching the ejaculatory duct, and the semen that is secreted by the seminal fluid will still be happening. So you will have semen after ejaculation. This is a common misconception, and I want you to know that you will ejaculate after vasectomy. And also, there are general myths like vasectomy will cause loss of masculinity, and all those are just myths. There will be no loss of masculinity. And to be honest, of the two surgeries, vasectomies have less complications, because the fallopian tubes are present intra-abdominally. It can cause bowel adhesions, etc. Right? Rarely, but still it can happen. Not in the case of vasectomy.
Okay,
Yeah.
Jeevan, we have a question.
Okay. Is it- Yes, sir. It is false. As much as I know, it is irreversible, and
Let me just read out the question so everybody else knows what the question
yeah,
is.
fine. Okay.
So the question says that I'm just going to read out, quote it. I heard about tying up the vas deferens for temporary sterile conditions, and as such is reversible if we untie it. Is that false? Over to you, Jeevan.
Um, Actually, I'm not sure. Let me.
Hello. Okay, so I'm going to answer the question because Jeevan's not here. Reversibility of permanent methods of contraception is it's very the probability is very low. You can reverse it in terms of anatomical or body parts. Now, if you have cut this part and tied the tubes, you can join the tubes back, and the same for the vas deferens. If you've cut the vas deferens and if you've tied the tube, you can join the tubes back as such. But how far the reversibility will be successful is a question. I'm going to post the question publicly, so if any of the panel speakers want to answer this question, then please go for it.
I would like to add a point in this. As far as tubectomy is concerned, The chance of reversibility depends upon the technique or the method they use to perform tubectomy. Tubectomy itself has many methods of the operation, and when our professors have explained it to us, they went from the ones which were done years ago and the ones which are done now. Now, the older methods are obviously not very foolproof. So, the chances of them connecting back together or, reversibility was more possible then because the techniques were not fully foolproof. So if you perform those kind of techniques or techniques in such a way that if you tell the doctor like I want it to be permanent now but I'm not very sure, I might want to get it back later on, then the doctor may consider to use a technique which would make it easier for them to reverse this operation as such. So again, it depends upon the technique they're using to perform these two surgeries.
Okay.
Yeah.
Thank you,
So if you
Siddhartha.
consider reversing it, I suggest you to use a different method of temporary method of contraception because yes, the success rate of reversal is not actually that much, and we don't know if you will be fertile again. That will be it.
Okay, so over to Hamza now.
All right. So the topic that I'm going to be discussing is sexually transmitted diseases or STDs. Now, there is a common misconception that you only get STDs if you have multiple partners. The reason that misconception exists is there is a higher chance, as given the fact that you are having intercourse with multiple people. But all you need to contract an STD is to have intercourse, unprotected intercourse, with one individual who has an STD, who has a history of an STD. That is enough for you to contract that sexually transmitted disease. Uh, there, regardless of what type of sex it is, whether it is oral sex, vaginal sex, or anal sex, all types of sex are possible ways for you to contract STDs. There is a higher possibility when performing anal sex due to the level of bacteria and other factors. Now, it's important to note that amongst all the contraceptive methods that we discussed, the only contraceptive method that will prevent or has a preventative quality towards STDs is the use of a condom. Okay. Now, moving on, the STDs per se are categorized into two groups. There is treatable or manageable, and there is curable. Treatable or manageable means we have no cure for it. There's no way to completely eradicate it from your system. But we have medications, we have treatment regimens that we can manage the disease with. And curable is exactly what it is. We have a cure for it, and it will be completely eradicated from your system. So an example of a treatable or manageable STD would be something like gonorrhea. Whereas, sorry, a curable one, my apologies. A curable one would be something like gonorrhea, whereas a treatable or manageable one is something like HIV/AIDS, which is we don't have a cure for it, but we do have ways to help treat or manage it. All right, and yeah. So when there are some early signs of STDs. These include the presence or the occurrence of a sore, wart, or rash in the genital area, redness in the genital area, irritation in the genital area, certain things like painful or frequent urination, abnormal period or discharge, pelvic pain, pain during sex, bleeding. These are all signs of STDs. It is not necessary that if you experience any of these symptoms that you have an STD. It is very much possible for it to be something else. Pelvic pain or frequent urination or abnormal discharge can be caused by a lot of different things, not just STDs. But it is very important to note that if you experience any of these early signs, or if you are someone who is having regular intercourse with multiple partners or have had unprotected intercourse with someone who you are not familiar with, it is important to get tested on a regular basis. And the testing for this is very simple, very straightforward, and the treatment or cures for corresponding STDs are also very generally straightforward. They involve very basic medications. They are not invasive. They are not something you should be worried about. So it is very important that you should get tested for STDs. And if you start experiencing any of these symptoms, you should consult a doctor and they will help guide you forward. And that's it for STDs. Next up is Vaishnavi.
Hello everyone, hope all of you are doing well. So my topic is MTP, medical termination of pregnancy, or as in common terms we call it abortion. So there are a lot of risks involved in unauthorized abortions, and it is more common than we think it is because we live in a developing nation like India, and abortion has a lot of conflict around it. So, and most of these go undocumented, which is why I can't give you a reliable statistic. Okay. Uh, Mothers across India, they take a lot of methods to undergo these abortions. One of which is they drink chemicals like turpentine or bleach, or they mix it with some drinkable concoction in hopes of inducing contractions to push the baby out. Otherwise, they take these chemicals and they insert it into their vagina or rectum and place it there in hopes of killing the baby. Now, all of these are very, very risky. Sometimes they might even insert sharp objects inside their vagina in hopes of inflicting injury. Or they might inflict external injury by jumping off some height or hitting their abdomen very hard or something like that. Uh, Otherwise, these mothers they go to people who are not professionals to undergo DNC procedures, which happens in not very sanitary conditions and in unideal circumstances, which is very, very risky. So the mother's life is at great risk here. She could have an infection, she could go in for sepsis, she can go in for bleeding and eventually death. In very rare circumstances where the mother survives these complications, most often she's left unfertile. Uh, for you to be approved for abortion, you need to fall under certain criteria. So one is medical criteria. This is when there is some proven medical cause saying that the pregnancy can be risky for the mother's life or for the baby's life. Uh, Abortion is approved. Eugenic causes. If you know that the baby is going to be handicapped or has some genetic abnormality or some disease, abortion can be approved. For humanitarian reasons, like if the baby was conceived because of rape, uh, in that case also abortion can be approved. In some cases, like in socio-economic cases, like you know that there is the baby's life is at risk or the mother's life is at risk after the baby comes, you can approve abortion. Or like in the uh, most common scenario, there is failure of contraception. Now, when can this be done? Abortion is legal only when it is done before 20 weeks of pregnancy. New MTP Act states that it can be done before till until 24 weeks of pregnancy if it is in the case of rape or something like that. Now, what is very important to note is that if the mother is 18 years of age and above, only her consent is important for the approval of abortion. She does not need the consent of her husband or the father of the baby or her relatives, parents, anybody. Only the consent of the mother is needed. And similarly, privacy will be maintained for all the abortions above 18 years of age. Who and where, who can perform the abortion? Only registered medical professionals can perform the abortion, where in all government hospitals, abortions can be done. If it has to be done in a non-governmental organization, they should possess a license. Next slide. Okay. Miscarriage. Now, miscarriage is something that is usually interchanged with abortion, which is very wrong. Miscarriage is a spontaneous loss of a pregnancy, usually before the 20th week of pregnancy. Sadly, one quarter of all pregnancies result in miscarriage, which is why we should be familiar with the term miscarriage. If a pregnant mother has symptoms of abdominal cramps, weight loss, vaginal fluid or clotted discharge, she's feeling lightheaded, has contractions, or she has fever with the other mentioned symptoms, she has to get herself checked with the doctor because she might be having a miscarriage. Now, why does miscarriage happen? It can happen to a variety of reasons. Most often, it is because the cervical wall is not strong enough to hold the baby, or she might be having some underlying disease. Uh, if the mother is over the age of 35, or if she has diseases like diabetes or some thyroid problem, or she's had previous miscarriages, she's at a greater risk of having another miscarriage. A common question that is always asked is that how long to wait before the next pregnancy? Now, this can vary between person to person depending on the reason why they had a miscarriage. So, ideally, it is they should wait anywhere between 3 months to a year to have to conceive the next pregnancy. Prevention. You cannot prevent something that is spontaneous, but if you know that there is an underlying cause like a disease, most often curing that disease can prevent a miscarriage. Other general healthy sexual practices and keeping a good health and being fit can help in preventing a miscarriage. We'll have a poll now. After that, it will be taken over by Siddharth Ma'am. Thank you.
Any slide? Okay.
Let the
There is
poll
a
get completed,
poll
please.
now, which is the legal age for intercourse. Like, what is the legal age for intercourse? And there are five options. If anybody can't see the poll, do let the host know.
Poll is not available.
Okay, not again. Okay, I'll read it out to you. What is the legal age for intercourse? And there are five options: above 15, above 16, above 18, above 20, and above 21. I will repeat: the legal age for intercourse is above 15, above 16, above 18, above 20, and above 21. So are you guys done? I think the
Yes,
poll is ending now.
the poll is complete now, and I'm publishing the results.
Okay, so most of you have answered above 18, which is the correct answer. And okay, in India, 18 is more than 18 as a
Just a
legal
minute.
age to. Yeah.
You're saying above 18. You mean below 18, right?
No,
So the legal
we
age for
mean
intercourse is from which age is what we're trying to say. So if we say above 18, it's like, from 18 and above. It's in that
Okay.
angle. It's not below 18, no.
Okay, okay. Thank you.
Okay, so the right answer is 18. Now, this answer actually varies with the countries when we are in, but in India it is above 18. In America it is above 18, but in UK it's actually above 16, which is actually a fact. And 21 is sometimes pretty confusing to some people, but actually 21 is a legal marriage age for men, and 18 is a legal marriage age for women. So that is something which some people tend to get confused with. Okay, now coming back to the current topic, which is consent, will, and privacy. Now, to talk about consent in one word is just permission. Nothing else is just permission. The proper way to define consent for a better understanding will come up in the next slide. So, next slide, I will talk more about it then. Will is basically the want or the desire to do something. In this case, we're talking about sex. So if it's will, it means you're wanting to have sex or have any kind of a sexual um, intercourse with some person. And consent without will and will without consent are two scenarios in which uh, it can be there. Like, for example, first I will explain what is consent without will, and I'll give you an example. Now, consent without will is when someone gives permission to have sexual intercourse, but then that person is not willing to have sex. This most common scenario is when women are being blackmailed to have sex with them. Like, say, this is kind of a way of rape, as in where they might be told, if you do not have sex with me, I will kill you, or they will do something to threaten them or blackmail them into having sex with them. So in this scenario, they do give the permission to have sex, but they're not willing to have sex. So that is a scenario for consent without will. Coming to will without consent, it is a situation in which a person is wanting to have sex, like he or she wants to have sex, but their consent is not valid. Such a scenario, I can give you a few examples in this. The most common scenario where consent is not valid is when that person is underage. For example, if there's a college boy who loves a school going girl, the school going girl is less than 18 years old, but the guy may be 20, 21, even 19, or even 18. Now, this girl, even though she wants to have sex with that boy, it is not legally right because her consent is not valid. Now, that is one scenario. The second scenario is when the person is a psychiatric patient. In psychiatric patient of any age, their consent is not valid. So even if that person wants to have sex with someone, their consent will not be valid because of the psychiatric condition. And the third, as it has been mentioned before, is if that person is not of sound mind, either when due to the influence of alcohol or drugs. This can be a situation where in a party, let's say that the woman is extremely drunk and she wants to have sex with someone, and the guy or another woman is not drunk but they also want to have sex. Now this is a scenario of will without consent. It is completely different when both the person are drunk. Now that's a situation where will is there and consent is not valid both sides, so that's legally nothing to do with that. But if one person is under the influence of drug or alcohol and the other person is not, then this is a scenario of will without consent. And privacy, it has been explained to you in detail during intercourse. Next slide, please. Okay, now this can seem to be a bit confusing, so I will read out here properly first, and I will explain it as simple as possible. This is the definition for consent. Consent means an equivocal voluntary agreement by words, gestures, or any form of verbal or non-verbal communication communicates willingness to participate in the specific sexual act. Now, to those of you who doesn't know what unequivocal means, it means unambiguous in a way that without any doubt. That's what it means. Now, it's to say that I'm being unequivocal about my decision to go on a trip to Goa. It means that I'm not having any doubts to go to Goa in simple terms. So, if this woman or a man is unequivocally, voluntarily agrees either by words saying like I want to have sex, or by gestures, which is a form of non-verbal communication wherein that person may be nodding to that person. He or she conveys that she is willing to participate in this specific sexual act. Basically, in other words, she is giving permission. Why the reason I'm using she a lot is because legally this is more accustomed or more concerned with women in our country, but men, men, consent is very important for men as well. It is a point to be noted, although many people don't see it that way, because the most common causes of problem, I mean, most problems of consent in India is mostly, related to women, but it applies to men as well. 1 minute, previous slide, sorry. But there is an exception to this. There are situations where a woman may not physically resist to the act of penetration or to the act of sex, but this should not be regarded as she is consenting to the sexual activity, because she did not verbally say that she wants to have sex, and she did not non-verbally also convey that she wants to have sex, like nodding the head or using hand signals or whatever. She just didn't resist. Now, just because she didn't resist does not mean that she is consenting. So this has to be very it's a very important point. Now, some of you might think that just because she's not resisting, that means that she is giving consent. No, she just simply probably does not have the strength to resist, or she may not be in a sound mind to resist. So that is a scenario over there. Will, I think, is pretty self-explanatory. It is to want or to choose with whom they want to have sex with. I don't think there's much to explain in this. I think we can move on. This is over to Tarini.
Okay, so this slide is basically for all of you to read. So we're going to let this slide be on display for the next 2 or 3 minutes. And I think everybody should know what rape actually is according to the law. After this slide, we'll be taking up questions. I've already noted down all the questions that you've been asking from the beginning of the slide, presentation. So if anybody has any more questions, please send it on the chat group. Okay, so I hope you've all had time to read through this. Also, we're going to start answering questions now, and we'll try to answer as many questions as possible. But for those of you who haven't gone through our emails, we have a WhatsApp group, and the link to the WhatsApp group is there in the PDF, which is attached in the email. Please do join the WhatsApp group. Whatever question we cannot answer here in this time frame that we have right now will be answered in the WhatsApp group. So we're starting with the first question. What is the difference between sexual objectification and sexual empowerment? Vaishnavi, you're not audible if you're speaking. Okay, 1 second, guys. I think there's been a. Okay, so I'm going to answer this question now. What is sexual objectification and sexual empowerment? So, sexual objectification is when you look at a person, a female or a male, just for their sexual parts of their body, just for sexual gratification. That's when you call it sexual objectification. When you do not consider themselves to be a person, and when you look at themselves only as a matter of sexual pleasure. And what is sexual empowerment? Now, sexual empowerment is actually there for both men and women. And this need not necessarily be termed as feminism as such, but sexual empowerment is there in every part of our lives. One is where women and men are given equal rights and job opportunities, and from casting votes to everything. And another kind of sexual empowerment is when men, the male sex, has to be empowered to express their feelings and to not be considered cowardly if they have feelings of sorrow or sadness or something. So we're going to move on to the next question. Someone has asked if menstrual cups are of any good to be used during periods. Okay. Okay, so I'm going to answer that question. Yes, menstrual cups are a very effective method or a very effective product to be used during menstruation. But there's a little catch in the whole menstrual cup concept. Menstrual cup come in three or four different sizes. So you must find which fits you best, and they also have different shapes. So you must find which shape fits you best. And for this, you can actually look through in the internet to see what size and what shape each brand offers you. And each brand will show you how to find the perfect fit for you. Also, menstrual cups as such is something that people can use only if they're comfortable with their own menstrual blood and with their own body parts. Because you must, if this is your vagina, you must put your fingers in to insert the menstrual cup. And when you take the menstrual cup out at the end of the day or after you're done using it, you will have to put your fingers back inside and take the menstrual cup out. And the menstrual cup is going to have blood on it. So you have to be very, very comfortable with your own body and with your own menstrual blood to actually be able to use menstrual cup. And also, when you use menstrual cup for the first time, it can be painful. This is just like how you have a penis inside you for the first time because the circumference is just about the same. So it can be painful, but it shouldn't be too painful. If it's too painful, then you should consult a doctor because you can have abrasions on the inner walls of your vagina, and this can also lead to infections. So I'm going to go over to the next question. How often should we avoid the urge to masturbate? And Saransh will be taking this question.
Okay, so basically, the in this question, if you say that if you think it's disrupting your daily life routine or relationships, you need to reconsider about that. Because it's completely a normal thing. If it's again coming in your mind, so you just need to just think about it, and also that it can also, as I told you, if it's excessive masturbation, it can cause fatigue and weakness, and because you're doing it too much, it's affecting your relationships and your daily life routine also. So you need to reconsider that. You can probably talk to someone who's close to you, or you can even consult doctors for that matter.
Okay. So the next question to Saransh is it true that too much masturbation can lead to erectile dysfunction?
No, that's actually not that's not right. It's a common myth, and the only side effects that I had mentioned was again the guilt and about affecting one's relationship and responsibilities. It will not cause erectile dysfunction. That's a myth. It can't cause erectile dysfunction.
Okay. So there's another question here which says, I read that excessive masturbation can lead to nutrients being released from the body and can cause weakness and fatigue. Is that true?
Yeah, so that's only possible when you do it excessively and not if you do it like once in a while or something like that.
Okay. So there's another question that says, Hi, I'm 23 and I haven't masturbated yet. I haven't even tried. Is it normal?
It's not a wrong thing, but why not? I would ask you why not, because it will help you know more about your own body, and you will feel more confident after that. And again, it's your own body. You can use it as a guide. You can learn new things from that. So just try exploring. And solo play is fun, I feel.
Okay, so just to assure all of you here listening to this session, if you choose to masturbate, it's totally okay. It's not wrong, and it's completely fine. And if you choose not to masturbate, that too is totally okay, and it's not wrong, and it's completely fine. Either which ways, it's totally normal if you choose to masturbate or not. Okay. So the next question here is, why should we know the sexual history of our partner? Okay, since Hamza, over to you.
Am I audible?
Yes, you are audible.
Okay. So it's important to know the sexual history of your partner, as it's a way to gauge their medical history. See, STDs, you can get it from, even if you are very safe and have only had intercourse with one person, if the person you have it with has had different experiences and has thus contracted an STD, you can contract it through that. So it's important to know their sexual history and medical history in order to make sure that you are fully aware of what is going to be involved and whatever precautions that you guys can take in order to avoid contracting STDs.
Okay. So this actually this point that we put forth, where we have to know the background of our sexual background of our partners and medical background of our partners, is because people have different preferences to sexual relationships now. Some people prefer to be in romantic relationships and then sexual relationships, but some people are fine with just sexual relationships and anything that's on the go, like one night stands or just friends with benefits or anyone you just meet newly. So in that case, it's very important to know the sexual history of your partner. Okay, so the next question is, how does sexual fantasies play a role in your sexual life? And also, someone has asked, how does sexting affect sexual life? Okay, Hamza?
Okay, so the first part of that is sexual fantasies, and the second part is sexting. Correct? Did I hear you correctly?
Yes. Yes.
Okay. So see, sex exploration with yourself, with your partner, is a very personal thing, and it's between you and your partner, you and yourself. And if sexual fantasies or sexting can add to that experience, and if it is consensual, if it is willing, if it is safe, and if it's agreeable by both parties involved, then as long as it adds to the experience, then there's nothing wrong with it. There shouldn't be a taboo associated with it, although it might be there in society. As long as you and your partner are comfortable, have discussed this before intercourse, know what is to be expected, and are agreeable to it in all the ways that we've discussed in this talk, then it's absolutely fine. One way to kind of, one common conversation that a lot of couples or partners should have is the establishment of a safe word. If you are going to be exploring fantasies, role playing, those kinds of things, or trying new ways of having sex, then establishing a safe word that if it's said during the course, then both partners stop and reassess and then discuss, and then if need be continue from there. So again, there shouldn't be any taboo. If it adds to your experience, then that's good, as long as it's discussed with your partner, it's consensual, it's willing, it's safe, and so on.
Okay. There's another question here that asks, if masturbation is not done earlier in life, then is there a chance to face any difficulty during sex? Okay, so no, whether you masturbate or not, it does not. Saranj, do you want to answer the question? I think you're on mute. Yeah,
Yeah,
go on.
actually, it doesn't affect any of. It will not exactly affect, but the thing is, you might not know exactly what the thing is then, because you never experienced it yourself. It's not like it'll really affect and you can't do anything. But I guess it'll be like a nice prep, or you might know better of what to do. That's it. Not like it'll affect. No, it's nothing like it'll affect or something. Anything else you can add?
Okay, no. Okay, so since we're running short on time, we only have a few minutes left. I'm just going to take some of the next important questions that I feel I'm just prioritizing questions. But the rest of the questions will definitely be answered in the WhatsApp group. So please join the WhatsApp group. Do check your emails and find the link to it in the PDF attached. So next question is white discharge and the female ejaculate the same? No, it's not the same. Now, the female ejaculate when during ejaculation can look like white discharge, but having white discharge on a regular basis is not the same. Females generally have white discharge during the times of ovulation. That's because you have increased secretions then. And they also can have white discharge for a few days after their menstrual period. But white discharge is otherwise also normal. And how to know if your white discharge is abnormal is when it has odor or it's too stinky or if it's very foul smelling. Then you're supposed to go and meet a doctor, and you could have a bacterial or an yeast infection in your vagina. So white discharge and ejaculation are not the same, but ejaculation can look like white discharge if the woman does not squirt and has vaginal secretions for ejaculation. So another question I have here is acne or wound with discharge on the breast, is that normal? Now, if you generally are a girl who has acne on her chest and if you have it on your breast, then it's normal. But if you do not have acne on your chest or on your arms or on your back and you have it on your breast and it has a discharge on it, then it could be an abnormality. It need not necessarily be an abnormality. It could be an abnormality, and it's better you go and get it checked. I hope that solves your doubt. And another question here is, what is the probability that a condom will not get stuck? Now, the reason why, I mean, condoms usually do not get stuck so easily into vaginal cavities, and that is because when you withdraw the penis from the vagina, you're supposed to hold the condom along with the erect penis at the base of the penis and then pull it out. So, this way, the condom and the penis are removed from the vagina as one unit. So that's very important. That's why removal of the condom is also very important. And I guess we come to the end of this session, and other questions will be taken up on WhatsApp. I hope you all enjoyed this session, and if you have any feedback form, please do fill it. I think over to Shiv now.
Yeah, thank you everyone for joining the session. To the panelists, to the wonderful panelists who took the session, and also the participants who were there promptly throughout the session and answering all the polls and asking interesting questions. Uh, you know, uh, we from Kadam and Ssshex team are trying to normalize a taboo, which we think that it should be spoken, and we'll be continuing to do these sessions a lot, and we hope to have more and more participants. So do tell about us to your friends and share about us so that they can get known to all the concepts that you are right now aware of through the session, right? And one of the important thing is that what we learn from the sessions that we do is from the feedback that we give. So we'll be sending you a feedback link onto your email along with the WhatsApp group's invitation, which will be active for the next 2 days. And if in case if you have any questions or doubts, you can post it onto the WhatsApp group. Now, as of now, it is restricted only to admins, which I'll be removing soon, and we can start speaking on in the WhatsApp group, and I'll be adding the panelists as well to the WhatsApp group for them to answer it, right? So again, thanks everyone for joining this session and being with us today, and that's it from me and our team. So yeah, I hope everyone are staying safe and healthy. Cheers to you all. Bye-bye from Shiv.